Hi, my name is Mike. I'm going to be your nurse today. So first I'm going to check your order sheet, and then I'm going to gather my supplies, which I've already gathered here. I'm going to wash my hands, which I've already done. And then I'm going to verify your name and birthday.
Jagni Patel, May 6, 1994.
All right, and I'll check that with your wristband. I can see it's the same. I'm going to then close the door for privacy. And then I'm going to explain the procedure I'm going to do. So I'm going to be checking your vitals today, which is going to be your blood pressure, your pulse rate, your respiration rate, your temperature, and your pulse oximetry. Then I'm going to raise the bed to the appropriate height and maybe perform this procedure. Can you tell me what has been going on? What are you feeling? Any pain?
My right calf hurts.
Your right calf hurts, okay. Can you describe what that pain feels like?
It's cramping and achy.
Okay. Does it stay in the calf or does it move anywhere else on the body?
No, it just stays in the area.
Okay. Can you, on a scale of 1 to 10, say how bad it hurts?
4.
10? Okay, 4.
So yeah, it's a 4 out of 10.
All right, good. And when did this start hurting?
After I went for a 3-mile ride.
Okay. And is it still hurting right now?
No,
No?
it just comes and goes.
It goes. All right. So I'm going to check your vitals first, and then we'll assess that. So I'll start with the blood pressure. We will first measure the cup to see if it's the appropriate size. Can you put your arm here, your palm face up? I'll measure it. It is the correct size. I'm going to place the cup 1 inch above the antecubital site. We'll just put it right there. Okay, so the patient had a blood pressure of 110 over 66, which is within normal range according to the American Heart Association. I will then assess the pulse rate, which I will do so on the right radial site. And I will assess for 30 seconds and then multiply by 2. After which I will check the respiration rate. Again, checking, counting 30 seconds, watching chest rise and fall. So, we had a pulse rate of 76 and a respiration rate of 18. If the pulse rate was regular, we count for 30 seconds and multiply by 2. If it's irregular, count for the full 60 seconds, and then verify that by taking a apical pulse on the fifth intercostal on the left midclavicular line for 60 seconds. And then for respirations, again, you just count for 30 seconds and multiply by 2 if there's normal breathing. If there's any labored breathing or use of accessory muscles or tripoding, you can again, count for 60 seconds to verify it. So after that, we will take temperature. I will hand this to the patient and say, place it under your right posterior sublingual pocket. And we got a temperature of 98.6, which is within normal range. And lastly, we will check the pulse oximetry. Put that on the index finger and see that it says 98%. We're looking for anything above a 95. So it's within normal range. Okay, so I'm going to lower the bed to its lowest and locked position. Going to assess my patient for any additional needs that she may have. I'll then dispose of any PPE that was used and clean any equipment, and also document all the findings. During this time, I will tell you that we can put a cold compress on your calf, and I will come back in 30 minutes to reevaluate and see how you're doing.